Right, I see folks starting to come in. Welcome, everybody. I'm going to take just about 30 seconds to wait for folks to get in. And I'm going to share my screen for a couple of slides. And as you're coming in, I encourage participants to introduce yourselves in the chat. Let us know who you are and where you're from. This is going to be a Q&A session, so please, as you're, let us know who you are, and then as we're going, we'll be taking questions later on as well. Right, fantastic. Alaska, they started early today if they were logged on. Thanks, everyone. Go ahead and continue to introduce yourselves. Welcome, everybody. My name is Laurie Kierstead-Joseph, and it is my honor and pleasure to serve as the Workforce Development Chair for the COABE Board. We have a really fantastic panel lined up for today to talk about workplace education. The goal of this session today is really to hear from, we're going to hear from 3 collaborations in sort of 3 different contexts who have gotten a workplace education partnership, not only just off the ground, but have built something that's really successful and is helping both our learners access the skills they need to be successful in the workforce, and is serving and meeting the needs of a local employer. I know we've had some great conversations at the discussion early this morning in the keynote, as well as I know there's been a couple of sessions about partners or employers like Tyson that are doing this on a really grand scale. My goal today was to zoom in to local partnerships that are developed between a single education program or a smaller education program and a local employer. And so that's the goal today. That's who you're going to be hearing from today. I just saw a hello from Karen Govan in the chat. She's also one of our workforce committee members, as is Jeff Arnott, who you'll be hearing from today. So with that, we're going to ask each of the teams, each of the partnerships to introduce themselves and give you just a little bit of an overview of the collaboration or the workplace program that they are collaborating on. And after we've had each of the groups introduce themselves, we're going to dive right into some Q&A. I have prepared a couple of questions and to get us started, but we will be taking questions from the chat as well. I do a little better, frankly, with chat than Q&A, but I will monitor both. You just throw your questions at us and we'll make it happen. What I would like to do now is I'm going to ask Beth Butterfoss and Kristin Driscoll to unmute yourselves and tell us a little bit about who you are and the partnership that you're working on.
Great. Hi, everybody. I'm so happy to be here. My name is Beth Butterfoss. I work for JVS Boston. That stands for Jewish Vocational Service. We're a large workforce development agency in Boston. We've been doing this since 1938. It was created for refugees coming from Europe, Jewish refugees, and then giving them job skills, language skills. And it was so successful that they just kept going. And now we welcome refugees, immigrants, people from Boston all over, and we serve about 12,000 job seekers a year. And my division works with employers because another part of our mission is to help employers retain and develop productive workforces. So I'm here with Kristin Driscoll, who is from Boston Children's Hospital. We work together on a number of initiatives with Boston Children's Hospital. We've been partners since 2007. And before that, we were sort of partnered. It started as a neighborhood development corporation. The large hospitals in one neighborhood of Boston joined together and were putting money into training their workforces together. And then it turned over in 2007 to be directly with JVS. We were part of that training provider before, and then it became just us. So we do English, ESOL classes, basic computer classes, and we've also partnered with them on larger initiatives, which were grant funded on pre-college preparation We also do pipeline programs with them for certain sectors of their employment needs. And that's what we are doing. So I will let Kristin talk a little bit more about how this is from the employer side.
Thank you so much, Beth, and thanks for having us here today. So like Beth said, my name is Kristin Driscoll. I'm the Director of Workforce Development. So within Boston Children's, I am on the talent acquisition side. And so when we talk about workforce development, we think of it as sort of our long-term strategies to how do we grow talent and help folks develop and build the skills they need to join us at an entry point at Boston Children's, but then to grow within the enterprise. So that's really where our partnership with JVS has been a huge asset for us. Certainly, we have employees who are taking advantage of all the different courses that we offer with our goal of really building that pipeline from that ESOL level 1 to a pre-college and then getting folks into community college, into four-year schools as a pathway to other career opportunities at the hospital. So that's been a huge asset for us and a partnership that really started as this is a great thing for us to do for our community, both our Boston Children's community, but our City of Boston community, and now has really moved into here's how we're showing the ROI on this partnership, and here's where we're seeing people move within the organization. So I mention that because I think as employers, sometimes it can be hard to switch make the switch from this is something we really should do. It's beneficial. It's a great employee retention and development tool to, no, we're now helping people grow within the organization and we're retaining and growing people who were started at the front line. So for us, that's a really huge aspect. And now we've moved in more into these pipeline programs that Beth mentioned, where we were struggling to recruit talent for certain jobs and realized that partially it was a skills mismatch in terms of the level of English that we were requiring, and we were missing out on a whole talent pool that were very close to that English level, but just needed a little bit of support to get to the level that they need for that particular role, working in the sciences or working in operations. And so we found that to really help us to move and build that talent pipeline. So I'm happy to answer questions as we go on, but I'll turn it over back to Laurie for the next group. Thank you.
Fantastic. Beth and Kristin, thank you both so much for being here. I look forward to learning more about your program. With that, I'd like to ask the folks from Florida to unmute themselves and introduce themselves and talk a little bit about their partnership. I think I'll hand it to Jeff first.
Okay, how's it going? Hey, my name's Jeff Arnott, and I'm the executive director for all of our workforce education programs here in Osceola County, Florida, which is the county south of the Orlando area. And we're right in what we think, well, it is the fastest growing area in the United States. And Osceola County happens to be the fastest growing area in the fastest growing part of the United States, where Florida's taken on 1,000 new residents every day. That they say is the largest migration to the state of Florida from folks within the United States in our current history. So we look at that as great opportunities of people to come down here and take care of our wonderful sunshine and so forth. But one thing that we've done, one thing from COVID, one thing that did happen from it is the fact that folks have got so much money from county governments, chambers, and so forth like that. And even us, we're having trouble spending it. I mean, it's like that. But after the county commissioners and the chamber reached out to us, and I first took this job over at the beginning of last school year, they really wanted to look into rapid credentials and also look at how we can get folks upskilled. And in fact, we have an initiative here called Skill Up Osceola, really trying to get folks that maybe want to move from one career to the next. And we found that most of those students were probably in our adult ed program at ALCA, which Karen's our principal of. We have about 4,000 students a year go through that program. So it is a large scale program in the eyes of many people. But one thing we found out that a lot of students definitely wanted jobs or better jobs and so forth. And now to just really put some nice icing on the cake, now we have businesses reaching out to us to try to provide some training for them for maybe some adult ESL students and so forth, to really try to build some loyalty. I think employers, and this is what I'm hearing from employers, they just want people to stick around. And one way to stick around is maybe build some of these loyalty type of things. I know we had a couple of health agencies here, Abbott Health and Orlando Health. They're our two biggest medical providers here. They're willing to pay pretty much whatever they need to pay for us to get students, maybe adult ESL students and adult GED students, those credentials to get them on board and get them working right away as a medical assistant and so forth. And I really wanted to invite David on. I'm glad you're on, David, really to talk about a small company. And he's got a medium-sized company. He's not that small, but really just thinking outside the box, reaching to us. And I work for a great superintendent, Dr. Pace, who always has the statement, always try to get to yes. And I do believe that. Let's always try to get to yes. I'm here in Osceola County. So this right here has been a wonderful success story that we really slapped together pretty quick and so forth like that. And anybody who ever knows me is like, hey, let's just throw it up on the wall and see if it sticks. If it falls down, let's make a new recipe that we throw it up there till it sticks. And I like building airplanes in the sky. But with that being said, I also like building airplanes in the sky with nice first class cabins and stuff like that. So let's talk to Karen. And Karen, you're the one that came to me one day and just said, Jeff, can we do this? And I said, let's get to yes. So Karen, it's all you.
Thank you. We were excited to go and meet with the Touchless boat cover folks. They have a real interest in making sure that their staff is able to not only meet the needs of their business, but also to be able to have an opportunity at any type of advancement in their career. So they came to us and said, listen, we've got folks that could be great shift leaders and managers, but they need more English skills. And went to my district, said, can we do this? And of course, Jeff's let's get to yes, has provided us a teacher to be present daily at Touchless Boat Cover with a full classroom of students in the afternoon, and they're learning English. So it's been really exciting. The stories that my teacher comes back and tells about the students that she has that are absolutely delightful. And we certainly believe that it's meeting needs of both the students in their own lives, but hopefully at the business as well.
Great. And how about David? Do you want to go ahead and introduce yourself and anything you'd like to say about how, just a minute or so about how you, why you bought into this collaboration?
And a little bit more about your company. I'd like to hear some more myself. I need a boat cover.
Well, thanks. I really appreciate working and finding you guys. We were looking for a company or anybody that would be able to provide training to try to, grow our people. We want them to succeed in life, whether they stay with us or move on. One of our goals is just to improve their lifestyle. And we're, just to answer your question, we're a small company, Orlando, Winter Park, Florida. Started here 20 years ago out of a garage, basically, and turned it into a national marine manufacturer of this touchless automatic boat cover. And we've got about 100 dealers throughout the U.S. now and about 55 employees. So, 75% of our workers have a challenge down here in Florida who's speaking, strong English, and communication was a big challenge, as you went through the different hierarchy. And there's so much talent out there that we know we could tap into if there was better communication skills. So we just started reaching out, like, where can we get an on-site trainer to come here, and we'll pay for it. We'll get them here, and didn't really poll our workers or anything. Just said, let's just give it a shot and see what we can find out. And had one of my office staff reach out to a few different county people and bumped into these guys, which are they're 5-10 minutes away from us, so very convenient. And it's worked out great. We had 26 employees enroll in two different level of classes. We were able to set up an hour classes, 2 1-hour classes a day. And we're already seeing, just an impact in our workers' morale. They're working better as a team. They're proud of the opportunity. And again, these are very, very bright people that are just struggling with communication challenges. And we've only been doing it for 1 semester, but if everything goes well, we'll continue doing it, further. So, and that's, like Jeffrey said, we weren't sure what we were going to get ourselves into, but we're really pleased with the initial results so far.
Fantastic.
Yeah, one thing, Laurie, I just want to chime in real quick. I know we got to move to the next group. One thing about, and this is definitely a Florida perspective, we're allowed to have these partnerships, these IETs and everything. And Dave, we just charge you the tuition for the students, I believe is pretty much what we charge. And that's just required by state rule. We have to charge $30 per term down here in Florida for adult ed services. But yeah, once again, it's, we could record that data. Now, of course, I'm only speaking for Florida. I don't know what other states do and so forth, but it's actually one of those things that that's a win-win, not only for Dave, but it's a win-win for us as well. And we sent him a good teacher. We sent somebody that we knew that was going to do a good job. I think that's key in this thing. But I just wanted to say, this is, like I said, this is just one of things that we're doing. And I really wanted to highlight that because Dave, yeah, my dad started his business in a garage, and so did Jeff Bezos and all these other folks. So I really like that American dream piece to it as well. So that's wonderful as well. So appreciate it.
Fantastic. Jeff, David, and Karen, thank you so much. I can't wait to keep learning more about this as we continue the dialogue today. Sounds like a really innovative and great partnership. So last but not least, I'd like to have our folks from Pennsylvania introduce themselves, Cheryl and Jenni.
Hi, everybody. Greetings from Central Pennsylvania. I'm Cheryl Hiester with the Literacy and Learning Success Centers, and that is the service of the Literacy Council of Lancaster-Lebanon. Located in Central Pennsylvania, cover a 2-county region, and we are one of 2 government-funded adult literacy and basic education providers in our service area. Our close partner, Lancaster-Lebanon IU13, and the Literacy Council work in collaboration to provide really comprehensive services that include basic skills, high school equivalency preparation, digital literacy, pipelines, programs into work and training, and then the combined education and training programs that we offer in partnership with skills trainers, higher education, and employers. So we're kind of unique, I think, in a space today that we're talking about, because Lancaster had been one of, I believe, 11 communities in the nation that was receiving Cuban medical parolees through January of 2017. So we are home to more than 200 Cuban trained physicians who defected from foreign service and found themselves resettled here in Lancaster. So we were in this space where these highly skilled, highly trained physicians were working and continue to work in entry-level jobs because of language fluency and credentials. So I think that's a really key piece. Like, while English language fluency is a really important thing for them, it isn't the only barrier. They really do face significant barriers to Americanizing their credentials and re-credentialing. Anyone who knows anything about this, people have to pass the United States medical licensing exams, which takes years and costs thousands of dollars. And then they have to be accepted into a residency, which is no small feat. That is really, that's like the block for many of these folks who are really interested in reclaiming their careers as a physician in the United States. So some of them are finding other pathways, and we'll talk a little bit about that. But as the United States faces really serious physician and nurse shortages, it is really clear that we cannot afford this kind of brain waste and experience in medicine in the United States. So 6 years ago, the Literacy Council partnered with one of our wonderful volunteers, Dr. Dan Weber, who really did lead the effort to start our program for internationally trained healthcare workers. And since then, we have had more than 80 participants in the program. Our focus has been on removing barriers to reclaiming those careers through language fluency, career advising, networking, and connecting to employers, skill training, and tuition assistance. And this year, our first international healthcare professional was accepted into a residency, which is a huge reason to celebrate. We have 2 more who just recently learned that they have an interview. So we've also had 6 international healthcare professionals graduate from Penn State University's 2nd degree BSRM program, and 6 more will graduate next month. So we are creating these pipelines. The really important partner that we have is our employer partner. And connecting these participants to job is what it's all about. So I was very lucky to know Jenni Black of Union Community Care, who was desperately seeking well-trained medical assistants and nurses to staff her federally qualified healthcare center. So I'd like to turn this over to Jenni now to talk about the perspective as an employer.
Hi, I'm Jenni Black. I'm the Chief Quality and Compliance Officer at Union Community Care. We're a federally qualified health center serving 2 counties. We have 7 medical sites. And our healthcare environment, which it shouldn't necessarily be for a federally qualified health center, but it's extremely competitive. We have 4 major hospital systems who compete to outpay each other. And so we are constantly in a struggle to get qualified staff. I met Cheryl through the Refugee Coalition of Lancaster, and we were talking about some of the programs they had. And I was unaware until the Refugee Coalition that we had all of the Cuban parolees that were physicians working in warehouses and manufacturing and food processing. And I couldn't believe that people were unable to get into healthcare professions when we are suffering from such a huge shortage of these core medical positions. So we're like, okay, we'll take as many as you can ship to us. We had a program where we were supporting their kind of integration into the medical system of the United States, like how to navigate healthcare, what's different between where you're from and how things are in our local healthcare environment. But we've had about 20, both Iraqi and Cuban physicians work for us as medical assistants, and all of them have become nurses, which is just fantastic, or are currently in nursing programs. And through Cheryl's program, they've partnered with a local school for those who their English language is not at the level to get into those programs. They're going to nursing schools in Puerto Rico and then returning to us. But I can say that without the support of the Literacy Council and the ESL support and the integration into the U.S. healthcare system training that the Literacy Council supports through Dr. Weber's program, we would be in a much worse off position staffing wise than we are. And the benefit that we didn't anticipate as fully, like I can't speak enough to, we're getting people with incredible technical skills, and they were only lacking adequate English language skills. So having these folks work in our care teams is just such a huge resource for patients and for our providers. So we're grateful for this partnership.
Fantastic. Jenni, Cheryl, everybody, thank you so much for being here. I've left the screen up in case folks are, I have a feeling after this, people will be reaching to you with other questions. But what I'm going to do is stop sharing so we can see all of you. And I'm going to launch in with some Q&A. And I had some prepared questions based on what I thought would get asked. And this one has been asked twice already. So I'm going to ask it out loud. And maybe we'll start, Jenni and Cheryl. You guys are maybe the most rural of the examples here, or at least the smallest of the metropolitan areas, if we can say that. How do you fund this? How is it funded? And were there challenges to that you want to share?
Jenni, should I start and then you kick in?
Yes.
Maybe, no, let's have you start because you should talk about the funding that you got to start the medical assistant program, and then we can talk about how we built on that.
We got funding from a bank who was looking to invest in the community to run a medical assistant training program, which was great. The bank came back to us the following year and said, how big can you grow the program? Because they were wanting to fund it. And we're a healthcare facility and not that big. We have 300 total employees. So there are limitless opportunities for good models.
Yeah, and what we did was we really wanted to be as flexible as possible. So we were looking at foundations and donors to support the program. So we wanted to bring real money into the program. And because we work with a physician who is a member of the Pennsylvania Medical Society, we did apply for funding and got funded through the PA Medical Society. And then we also reached out to some of our major donors who invested pretty significantly into the program. So it was really just going out and talking to donors and then looking at how we can use some of the state federal money for the English language piece, but then really getting money for students to pay for tuition. That was a real barrier for people. So we didn't want them just hanging, and many of them would not have qualified for like financial aid because it was a part-time program versus a full-time program. So we really did try to remove as many barriers as possible. And later, with our partner IU13, we applied for an Office of Refugee Resettlement grant for the career pathways grant, and we were able to use some of those dollars as well. So we just continue to strive to find ways to keep the program going.
That's fantastic. So I love hearing that the adult ed piece, the instruction, you had funding for that, right? It's about the tuition costs for the other piece of it and being a little more creative there. Thanks for sharing that model. I wonder, Beth and Kristin, if you want to share how does the funding work in your situation?
Sure, I'm happy to jump in. And Beth, also has a lot of examples from other employers they work with too. But I think Beth shared that our partnership started through different grant funding opportunities, but now at this point, at this moment in time, everything, these services are paid for out of our budget. So I think what our story can really show folks is how do you make that business case to your senior leaders? This is impactful. This is changing opportunities within our hospital, and this is helping to grow our own and build that retention and engagement piece. So a couple just things to mention. I mean, certainly if folks are building new partnerships, getting on all the lists that Cheryl and Jenni were just talking about in terms of different grant opportunities through your state. Some states also have unemployment insurance pays for some additional training dollars that employers can leverage. If you're an employer that pays into that, we do not, so we're not eligible. But some employers might be eligible for those types of training funds, which is great and always something to look at. But I would say we're also getting really creative, partnering with other employers. When I first started out in this work, we were sort of on this journey that the hospitals, we're all competing, right? And we're hearing that today. We're all competing for the same talent. And so now we've gotten to a point where we're part of, we may not be receiving dollars for a particular grant, but we're an employer partner on a grant and we're receiving, graduates from a program, which is really at the end of the day, what we're looking for as an employer is to fill those open positions and to provide great care for our patients and families. So the last thing I'll say, and I'll turn it over to Beth, is that, the majority of our programs are covered under, my team's budget, and that's really years of advocacy to our senior leadership. But the other thing that we've done recently is really talking to particular departments and saying, we know you're having a tough time recruiting, we'd like to try something different. And if they have dollars in their budget to kind of cross-fund or co-fund things with us, then we can bring in a JVS partner, another partner to make that possible. So I think we sort of get creative and we leave the dollars to make it work, but that's kind of how we're approaching it. So Beth, I don't know, please add if I missed anything.
No, that's pretty much covers it. We work with a lot of different employers, both big and small in Boston, and we often do start with some kind of grant funding. And I think one of the, especially with just starting out, many people start out with ESOL And I think when they see the impact, I think what Dave was talking about on the morale, the feeling of being a team, the appreciation for their job, for their employer, when they see this impact, you know, they might go into it thinking, okay, they're going to understand safety regulations better, or they're going to do this thing better according to their job. And then they realize, you know, suddenly these people are talking to them and saying, how was your weekend? And, you know, my daughter graduated from high school and here are some pictures. And they've told me that, you know, it opened up this whole new world for them about how they see their workers and how much they realize they need to invest in these people that, you know, spend their whole lives doing the work at their company. So I think it's almost like people get hooked after the grant funding ends and they don't want to stop. And so, like Kristin said, they think of different kinds of creative ways, consortiums. We have a couple different, like the hospitals are an example. We also have a group of small businesses that chip in and all send people. So I think, you know, once people see that human impact on top of the business impact, you know, it all kind of makes them realize how important this is. And especially now when like where people are searching for workers, this is a real incentive for people to stay, to feel loyalty to their employer, to tell other people what a great employer they are. So I think that's where it all starts to grow just organically from there.
Fantastic. Thank you, Beth and Kristin. I love that idea that you might need to start with some grant funding, but the buy-in is built quickly, especially if you're paying attention to those ROI pieces. I love that. So I think Jeff already answered the question about how theirs is funded. So I think I'm going to switch and I'm going to circle back to Florida. And I want to ask Jeff, you and Karen talked about getting to yes in serving the needs of David's company. What were some of the challenges you had to overcome to get to implementation?
Well, I think some of it's just time. I think that's what it is. In order to build it up to a program where people are coming to you, you have to get out there and beat the pavement, really go talk to people, meet people, go to every event. In fact, our relationship with the Greater Kissimmee Chamber all started with me walking into their place and wanted to see Dave Newstreet and said, hey, I just want to set up a couple tables just to talk about adult ed because it's always a good day to talk about it. And he said, then we sat down and started talking about a roadmap and a whole career pathways plan and industry pipelines and local pipelines. What we have here in Osceola too is we have a group of like medical professionals with our high school. Now I do run the high school career tech programs and I run our technical college here too. You know, how we can pipeline these folks from basically high school kids through apprenticeship programs and so forth, and then VOTEC. And then I brought in the adult ed piece. That was the piece that nobody knew anything about. And so forth. And now it seems to be the cream of the crop now, the cherry that everybody wants is that group because they can work today. There's less competition there, I think. And I think that's one of the things. Probably the biggest challenge is just what I told you, telling people what adult ed is. Sometimes they just do not know. They don't know. In fact, people in our school system, I have to go out and educate them. And I think that's the key. And you got to stay on top of it, stay on top of it, and stay on top of it, and be willing to be creative and think about it. Like I said, I don't say no. I try my best to get to yes. I really do, unless it's something illegal or something. But we really try to get to yes. So
I love that.
I think that's the key. You just got to try to get there and use different funds. And I know somebody mentioned it too about, you know, Career Source. That's our Department of Labor here in Florida. You know, money's coming down from the governor's office and they're throwing money out of the Tallahassee. I don't know where they're getting the money, but they're just throwing it around. We're there to take it. And also the state legislature. And then, of course, we do have an allocation in Florida, too, that's actually our state, I think, really does a great job in putting money behind workforce ed. It traditionally has done that. You know, our program alone gets about $5 million a year to run adult ed, our vote takes our college, and so forth. So we use a variety of funds and we're creative. And our state has been pretty good about letting us be creative. And I think that's the key as well. And advocating for the legislatures. I know, Laurie, we've done it before, gone to Capitol Hill and talk about adult ed and so forth like that. Letting them know flexibility is the key. And I think letting them know, let's do more than tape test before and after and all that stuff they've been doing since the Johnson administration. Let's talk about things that we can do to be creative. And I think that's the key. Sometimes our lack of creativity from the feds holds us back. So I think that's what we got to do. I'll
Jeff,
shut up
that's
now.
great. I think both Karen and David want to weigh in. And one of the things I'm not sure I've heard exactly is how did you find each other? I know David was looking for help with his workforce. So Karen, maybe you want to start?
Email is how we found each other. Email. They reached out via email to one of our marketing folks, and she came to me and said, hey, this company really is interested in having some English classes, and could we do it on site? And I said, well, sure, why not? Ideally, that's the best place to do it when folks can see the immediate application. And so we went up and met with them, and we took a tour of their beautiful facilities there in Orlando. And then I sent a teacher up to really see what it is that the students did every day, so we could tailor some of our vocabulary and workplace skills and conversation to the workplace environment of which that they work. So, and our goal is that, certainly that they would be better communicators with the terminology that they need to use there.
David, go ahead.
Yeah, I definitely want to hit on a point that Jeff said. With me, when I sent a couple of admins out looking for somebody to teach our people, I could have paid for them to go to school somewhere, but really it's flexibility, right? So if I would have had an enrollment, I bet you 60-70% would drop out if they were having to travel, offsite. Some of them, transportation can be a challenge. So that was why I was like, I really want this to be an on-site class, because I just felt like we would get the most participation if it was convenient and flexible for the workers. And it had to be an on-site class. It wasn't, can I pay for them to go to school somewhere else? Because I don't think that would have been as beneficial. And then I was really impressed, and kudos to you guys, and I haven't said this to anybody yet, but really impressed with, just like Karen said, the teacher, within a few short visits, had asked for a lot of, terms and vocabulary that they use on a day-to-day basis here at the factory. And that really was not part of my initial mindset. My initial mindset was, let's just overcome their hurdles, right? Let's create a better lifestyle for them. And the minute, I'm walking through or hear them talking about components that they're building out there in the factory, I was really impressed. I was like, yeah, this is really working out amazing. So
fantastic. David, thank you so much. I want to circle back to Jenni and Cheryl. I actually think you did mention how you found each other, but I wonder if you two could share a little bit about what hurdles or challenges you had to overcome to get the program up and running for the collaboration.
I can start off. I think one of the biggest hurdles we had were finding time to have the classes. And then the portion we did, the medical assistant training program that we did was didactic and then skills. And it was hard to find good preceptors who were interested in training staff and who were good at training. It did slow down our workflows, but then we had pretty much organizational buy-in that the investment was absolutely worth the slowdown and the extra effort for training.
Yeah, I think that is absolutely true. I think the other thing that was a challenge for everybody was this was a distance learning experience for folks who are limited English proficient, and their teacher was in Boston, and all the students were here in Lancaster, and their ESL teachers here in Lancaster. But I think everybody did a really good job of staying connected, and I think it was also the first time that the skills trainer had to really open up her classroom to having an adult literacy person, like working with her side by side. So there were a couple of things to work out. I did fail to mention, though, that one of the wonderful things that we had access to when we did this initial partnership with Jenni and her healthcare center is the Pennsylvania Department of Labor had released these innovation grants that year. And we had received one of those through our workforce development board. And we were able to use that money to put a full-time person like in that program with those students for the whole 7 months that they were in. So that was a real gift to us that we had, Linda, who was the ESL teacher, was able to be there every single day. So whether they were in like asynchronous or synchronous class, if they were even in the workplace, she was there to help them and support them.
Such great information and examples of how the adult educators, what kind of time is needed to get ready to do this kind of instruction well, and that you really do need to sort of wrap around and support the learners fantastic. Beth and Kristin, did you want to share any challenges you had as you got this collaboration up and running, or as you've progressed?
I think a lot of the challenges that the workers face in Boston is they often have to hold down 2, sometimes 3 jobs just to be able to live here. So it's been challenging for some of them, I think in the past, a lot more employers, when I first started in this field 20 years ago, a lot of employers were paying release time. But once a program has been in place for 5-10 years, sometimes this becomes really hard operationally for them. So they move to more of a model like this is a benefit that we're paying for. And we sort of had the classes around the beginning or end of the work shift to make it more convenient for them, also on site. So that continues to be a challenge because sometimes people just can't stay after work or come early because of other jobs, childcare, many things. And I think that's one of the main challenges that we face with people just being able to persist. But sometimes, they're able to make it work if they're really motivated. And some employers, do try to do half release time. So they do like half on their job and then half on their own time. But I would say that's the major issue, that it's almost impossible for employers to sustain a training that takes people consistently off the floor. And at the same time, it's hard for the workers to find the time to do it outside of their job. And the thing about it's this kind of training, like language training, takes a long time to learn how to speak a language well. And so it's not, a 6-week training or, a 2-day training or something. So you're talking about a long-term investment. So I think that continues to be a challenge. And I'm not sure what the answer is, but that continues to be a challenge for us here.
Yeah, I don't have too much more to add, but I mean, I think the one piece that's I would say on the employer side that's challenging about all of this is how do we kind of stay ahead of what the needs are going to be of the learner, the employee learners. I think that part is really challenging because we know that all the operational pieces of, regardless of the partnership, we got to get the instructor, we got to get, is it a classroom space? Is it, what's the proper virtual learning environment? Like we have to get all those pieces kind of teed up. And sometimes I think that can be challenging, especially in the healthcare world right now, as folks can imagine, day by day, things are sort of evolving and changing. And so I think that for me right now, for our teams is really challenging. And just also for our staff, like Beth is saying, folks are exhausted from the last 2 years of, working in a pandemic and responding to that. So thank you.
Wow, those are really, that's really great to hear. Just it's always fabulous as an adult ed provider to hear employers who have such a deep understanding of who their employees are and what supports they might really need. Oh, good, Cheryl. I was going to pose the question about synchronous and asynchronous. And I, we haven't talked totally about modality. I would love to just go around the room. And Cheryl, you mentioned that yours was not only synchronous and asynchronous, but virtual. Is there anything else you want to add about the modality or how you're delivering instruction?
Well, I think like in that particular example, it was, with the skills trainer was the that's who said how that worked. So we were there as a support. So we have many other types of programs like ESL in the workplace that would be structured really differently. And what we've really tried to do is allow the employer to lead that process. Like, what are they willing to commit to? But then we can be discerning in who we're willing to work with. Because if there is no employer investment, if there isn't that kind of support that employees need, then I would really rather not work with that company. I would really like to save our resources for companies that are serious about this and really, want to do it the right way.
That's great to hear. And how about Beth and Kristin, what's the modality for your example?
We were in person originally. We have a training site in the middle of this neighborhood where there's 3 major hospitals, and they were all sending their employees to this. So we had training classrooms. When the pandemic hit, we needed, that became kind of, we weren't allowed to have that many people in one space together. So we shifted to virtual learning over Zoom, which, my instructors did an amazing job shifting gears. I think it was a new thing for everyone. They've gotten a lot better in the last 18 months at this. And also the employers like Kristin and they were super understanding and super supportive and just wanted to try and keep offering this to whoever could still make it. And I think especially with our healthcare workers who were going through a really serious, traumatic, emotional, exhausting kind of experience, even the virtual classroom became like a sense of community, and people kept coming because I think it gave them some grounding in an otherwise we've shifted the times. We were trying to do it at the same times that we used to do it, right after their shift or right before. And so people were in the parking garage, in their cars, on their phone, in a hallway, in a closet. And this year we finally shifted to more of an evening. So the people who end their shift at 3 or 3:30 have time to get their kids, get home. And they've been joining from home, and they said it's a lot less stressful. And we have a similar earlier morning one for the evening shift people. So we've been doing it like that. We've been doing it virtually at manufacturers. It depends on the site. Sometimes it works fine, and sometimes we're now shifting back to going in person to some of those manufacturing sites because it was just too challenging virtually. So we're looking forward to being back in person, and we probably will continue with both, because for some people the remote situation has worked out well, and for others, especially very, very beginners or people with lower digital literacy or lower literacy in general, it was too challenging. So we definitely want to get back in the classroom to reach those people again, or back at the work site, because that's where we usually teach. So
thank you for that. What a great example. As we get ready to wrap up, I just want to thank all of the panelists who are here today. It's a big panel, but it's so great to hear about these 3 different collaborations. I think the bottom line with workplace education models is that there's no one way to do it. And not only is that the case, but Beth just showed you that they had one way to do it and they had to shift and change, and they're still shifting and changing. And I think everyone on this panel, you are all innovators who think creatively and have found a way to make this work for your students, for your employees. And I am grateful for you sharing your expertise today. I really appreciate it. I expect there are folks who've been listening who would like to reach back out to you at some point in time. I'm happy to be a connection if I can help with that at any time. But I have to wrap us up. Thank you so much, everybody. Beth, Cheryl, David, Jeff, Jenni, Kristin, Karen, thank you so much for being here today. And thank you to the attendees as well.
thank you.